Hello everyone, I am Dr. Desalegn, co-founder and CEO of Lifeline Addis home-based healthcare services. So at Lifeline Addis, what we solve is a two-sided problem. On one side, there is an increased number of non-communicable diseases like stroke, cancer, hypertension, diabetes, and other complications. And our healthcare system is not designed to cater for them. On the other hand, there is an increased number of unemployed healthcare professionals like doctors, nurses, physiotherapists. What we do at Lifeline Addis is bridge the gap between the two. We provide high quality, personalized, and customized home-based healthcare to patients requiring long-term medical condition at the convenience of their family and the comfort of their home. What inspired us to start Lifeline Addis is my experience when I was at St. Paul's Hospital. While working there, we usually see hundreds of patients, but most patients with long-term medical conditions like stroke and cancer will only have limited time to stay at the hospital because we don't have the right resource to rehabilitate and care for them for a longer time. And we just send them home with little to no support. One incident where I went to support a friend's family at their home showed me that they are really in a dark. And I learned that patients with long-term conditions like stroke and cancer and their families go through lots of struggle. It's that inspiration to change their lives that started Lifeline Addis. Lifeline Addis consists of a multidisciplinary team of healthcare professionals, mostly young and energetic. It includes doctors, nurses, physiotherapists, and nutrition and exercise guidance. At Lifeline Addis so far, over the past 5 years, we have cared for more than 15,000 patients and their families. In doing so, we have created more than 300 jobs. We are currently based only in Addis, but with the support of GRV, we want to expand throughout the nation and hopefully to other East African countries. GRV was a phenomenon that really turned out the startup ecosystem of Ethiopia, and it was a great pleasure to be part of it. More importantly, to win it. GRV was a start of the biggest next stage at Lifeline Addis. With the support that we are getting from GRV, both financially and also in terms of acceleration, we believe we will expand to all regions of Ethiopia, serve 500,000 families, and at least create 10,000 jobs. A great opportunity for us, and we want to make sure we capitalize on it significantly. We have 4 pillars where we want to use GRV for. The first is we want to increase our operational capacity. How do we do that? We want to expand to all regions of Addis Ababa. We already started expanding to Dredwa, and our branch in Dredwa will be coming up very soon. We also want to expand to Jijjiga, Adama, and Awasa in the next quarter. We also want to increase our human resource capacity to enable us this growth. We are actively recruiting a lot of more healthcare professionals. We want to get to a point where we have 1,000 registered, vetted, trained healthcare professionals that's going to support our growth. The second thing we want to use out of GRV is increase our quality of care. We want to provide very customized new cares. For example, we want to start mental health care, we want to provide dementia care, and we also want to start caring for children with special needs. All of this wouldn't have happened without the resource we are getting from GRV. The third thing is we want to scale. The first 2 things I mentioned might be related with this. With foundation in increased operation and with increased quality, we want to scale as much as 20x in the next 6 months with the support we are getting from GRV. But it's not going to be enough. We also have a very big ambition where we are serving 500,000 people and creating 10,000 jobs. To enable this, the 4th most important thing we want to do with the GRV support is making us investment ready. With that in mind, the accelerator that we are getting from GRV is very instrumental. The accelerator program is a whole-rounded program that helps us in marketing, finance, business development, and human resource development. We are actively engaging in the GRV's accelerator program to help us craft the ambitious goals we are envisioning. One of the most important things of winning GRV was, the first was internal. Our team is really motivated. Being a startup is not easy. We are overwhelmed, we are always frustrated, and sometimes we doubted ourselves. But winning GRV gave us the internal motivation I and my team needed to know that we are doing the right thing. The second thing is it gave us a significant external visibility. It was usually us startups looking around for investors. But with this win, most startups were already approaching us and they are already exploring potential ways of investing with us. So it was a significant thing that allowed us to be out there for the public. A lot of people are already reaching out to us, investors like I mentioned, and just regular diaspora that said like we never knew this existed. The diaspora that's calling us, like appreciating us and asking what ways of supporting, and a large number of people that are already requesting our service. It actually bridges the gap between us in Ethiopia and the diaspora who wants to know about its country and give back. As the first place winners of GRV, at Lifeline we have a great responsibility. We know Ethiopians are looking at us. We know startups are looking at us. And we know there is a huge skepticism among the different players in Ethiopia that Ethiopians can't absorb fund like this. We want to make sure we absorb this properly and make sure we grow tremendously so that GRV not only continues, but it continues bigger and better. And to do this, I want to send a message to the diaspora. We thank you for believing in us. And we are confident that with what you see from this cohort of GRV, you'll be motivated to even help more for the next GRV. My vision is the next cohort of GRV winners will be rewarded more and give support even better. I understand doing business in Ethiopia is hard, but at the same time, we have plenty of problems. And where startups thrive is where there is problem. And I think the better way of seeing this, every problem as an opportunity. And the fact that almost everything is just getting started means there is a large room for the youth to do something about it. You know, like I can proudly say I'm one of the largest home healthcare providers. I will not be able to say this anywhere else in the world. So I would rather be motivated that there is a lot of problem and a lot of ways of solving it. So I would like to encourage the youth to start with something and just go for it and see what you learn from it. And it might take time, but I believe in the long run, this generation is going to be the most impactful generation of Ethiopia. The GRV Summit was truly the beginning of our next chapter, and we are extremely grateful for Ethiopian Diaspora Trust Fund for making it happen. But Ethiopian Diaspora Trust Fund wouldn't have done this without the support of the diaspora. So I would like to sincerely thank the diaspora for believing in us and continuing to support us. I would like to reassure you that we'll make sure we succeed in what we do, we impact more lives, create lots of jobs, and make sure you are proud of us. I would like to encourage you to continue what you are doing and give back to your community. Thank you very much.